Hi, this is Dr. Nikita from Max Hair Clinic. Today I'm going to talk everything and anything about hair. But today I'm going to talk in detail about hair transplants and the procedures for hair. But if you're still concerned about why you're losing hair or what kind of hair fall this is, make sure you check out our previous podcast where I talk in detail about that.
So, this is one of the most asked questions, Mom. What's the difference between a hair transplant and hair retention treatments?
So I like to broadly classify hair treatments as retention treatments and restoration treatments. So retention treatments majorly focus on retaining your hair, strengthening your hair, or delaying your balding. So under these retention treatments are your treatments where you can have supplements, you can have topical applications, you can have PRP, GFC stem cells of everything that has come now. Coming to restoration, where you restore something that you have lost. And if you've been bald for a very long time, that's what I would like to say simply. You go for hair transplant. So hair transplant is a surgical procedure where you take your own hair from a place where you have good hair and you keep it in the place that it is needed. So I would say this is surgery and this is a clinical procedure which is minimally invasive.
What is a hair transplant and how does it work?
So hair transplant is a surgical procedure. It's an outpatient procedure where for simply saying like in layman's term, it's like agriculture. Like you take a plant, a pot from one place and you plant it in another place. First all the leaves fall down and then the leaves come out. So it's majorly very similar to that. You take your hair, the root of your hair, from the areas we call the donor. To be in the layman's term, it's a place where you're not going to have hair fall, majorly focusing on the backside or the beard. It can be chest, but we can get into that later. So we take it from these places and we plant it where it's affected, where you would want your hair to look good. So it's a surgical procedure which involves you going under anesthesia. I mean, it's not painful, but then anesthesia is involved, injections are involved, blood tests are involved, surgeon is involved. So yeah, that's hair transplant.
What are GFC and PRP treatments?
GFC and PRP, I would actually like to say they're both same. I mean, I know a lot of people are going to say no, but I look at it in a way like they're basically the same thing. You take your blood, you centrifuge it. Centrifuging is where you separate the ingredients in your blood, like your plasma from your red blood cells. So you remove your plasma and then you inject it in places where it is needed, where restoration or fixing is needed. So this, as a layman's term, is called your platelet rich plasma, your PRP. GFC is more of a marketing term, I would say. It's your growth factor concentrate. Some people use different tubes for it. They use different liquids where the concentrated mass from your blood is removed. Some people, it's just a way of selling it for a higher price. So if you look at PRP and GFC, I would say PRP is like your first layer of your blood, and GFC is a more concentrated version of it. Now coming to how good the quality it is, it's the way it is done. So in Max Hair Clinic, we have a treatment called GFC Fibrin Plus. So GFC is your plasma, your blood, and the fibrin is our product where we have concentrated growth factors, we've got peptides, we've got nutrition, we've got vitamins and minerals where it mixes with your GFC and then it is inculcated to the scalp. And how we are different from all other clinics providing GFC is because of the kit that we have. If you look at our the instrument that we use to remove your blood, it's completely different. We don't use regular test tubes. I'll get in detail of why we don't use regular test tubes, but this particular kit is designed to take the growth factors from your blood. So that's how we are different. So if you are comparing GFC and PRP, PRP is a bit more advanced version of your blood.